think that they are the pioneers in management. Actually, it is not.
Where you get the motivation, like I have to publish the book.
So that is the inspiration that I want to give to our young generation.
Hello everyone, welcome back to SGSH publication. Today we are having Dr. Alok Kumar Mathur sir with us. So first of all, heartiest congratulations for your four published book with us. So sir, I want to ask you, how are you?
Good. This was a good feeling, and I have good experience with your publications and the smooth functioning of your the way you are working is very smooth. So this gives a big relief to the authors. Thank you so much for everything.
It means a lot to us. Sir, first of all, please tell something about yourself so our audience can know about you.
Okay, so my name is Alok Kumar Mathur, and I am from Rajasthan, the largest state of India. And you can also say that it is the pink city. Jaipur is known as pink city of India, and it has many forts and palaces. I have been born and brought up in Jaipur. I have done my PhD in commerce and MBA in human resource development, and I am teaching for last about 36 years. So now onwards in this year, I thought that I should write a few books, and I found your publications very interesting. So I identified you as the person who will publish the books. So that is why four publications are with you. I am into research and training and teaching. So I'm teaching the students who have done their MBBS or BAMS or BHMS. So those students who are basically doctor, but they want to become hospital administrator or health managers. So we are having a program of MBA for them. So I'm teaching two subjects. One is principles of management and the other is communication planning and management to these students to become a good manager in the healthcare delivery system of India.
Wow, you have many degrees, and I think we are very small in front of you. So, heartiest congratulations for whatever you are doing. And at this age, you are publishing four books, writing, editing, and it is not easy, right? So, how you get the motivation from where you get the motivation? Like, I have to publish the book and I have to do research and other things.
See, my first research I started in 1989. So that was the time
Wow.
when my professor told me that you should work in the field of education. And at that point of time, first my publication was published in one of the journal that is called as Yojna. So Yojna is the India level journal. It is published by ministry. So in that, during my PhD time, I published four articles in different journals. One was in the cooperative, and the other was in the cooperative is published by NCUI, and Yojna is published by the ministry. So those kind of journals. So from there, gradually I moved into this field that I should be doing the research as well as publishing. So whatever is my understanding, little understanding I have about the subject, that should be known to other persons. So this kind of thing started in 1989, and from that onwards, I am publishing a number of things. I was associated with some of the international universities like University of Manitoba and University of Montreal. Both are Canadian universities. So there I was doing HIV/AIDS project and the project on vaccination with the children of India. So those kind of demonstration project. And I also worked in the field of education So Lok Jumbish and Shiksha Karmi were two of the innovative education project which brought in about 1990s. So they changed the whole scenario of education in Rajasthan. So earlier we were having very low female literacy rate in Rajasthan, but because of these two innovative projects which were launched in 90s, the whole scenario of literacy changed. So into education and health, I was working, and gradually the motivation I get from my students. So they are actually the source of the motivation because the way they ask me the question and the new questions, new set of questions, for that you have to search for new set of answers. So that kind of
True.
motivation we always get from the students.
Wow, wow. I think you have described very well. And as someone with the diverse academic background, so you have little influence your approach to the hospital and health management. We have get your book that hospital and health management. So what you want to say about the what we can improve in the hospital and health management industry?
There are a number of things, and there is no a single approach that can be implemented in all the hospital and health management situations. So for every hospital, you have to
Yeah.
customize your approach according to the situation of that hospital. So if you go to the
True.
tertiary care hospital, which are into the private setups, those corporate big hospitals, there the approach has to be totally different. Whereas if you go in the government hospital, there
Mm.
are different kinds of challenges. So for different kind of hospitals,
Yeah.
there are different kinds of issues and challenges, and you have to customize the approach. So for every hospital
Mm.
and the healthcare delivery center, you have to have a tailor-made approach to improve the healthcare delivery system in India.
Yeah, definitely. And I think there are many much more required. We have to, I think first thing is education is somewhere lacking in this industry or any industry. So do you feel that something we can improve in the education part?
See, earlier, what was the scenario in India? Most of the hospitals were managed by the doctors, but the doctors are not trained in
Yeah,
management. For that, you have to
true.
have a specific cadre of people who will be managing a number of things in the hospital. A doctor cannot manage those things. A doctor should focus only on treating the illness. So
Mm.
these kind of managers that we are training here from Indian Institute of Health Management Research, IIHMR University, they are the doctors who are trained in management, and they will be looking for the management of these private big corporate hospital as well as the government hospital. And the biggest program like National Health Mission in India is the flagship program of Government of India. So there also you require managers who can have good planning as well as policies to be implemented in India in order to improve the management practices in health.
Definitely. I think that can be done with the time. And sir, in your second book, in Management Principles and Practices from Ramayana and Mahabharata. So, what is that is in your book, and how we can inspire from our ancient times stories?
Yes, so that was again an inspiration from a classroom transaction that when I gave the examples of Mahabharata and Ramayana, the students were very inquisitive. They wanted to know more about management practices at that point of time. So I used to tell them the stories and then linking those stories with the management principles. But actually, if you see in chronological order, the Ramayana thing came first and then Mahabharata and then the management principles were born. So first of all in
Yeah,
1911 the principles of management were given, but Ramayana and Mahabharata were age old things, and we
yeah,
we actually forgot those management principles which were given in Ramayana and Mahabharata. And because we forgot our own thing, that is why the other countries took over and they think that they are the pioneers in management. Actually, it is not. So the Ramayana and
Yeah.
Mahabharata basically they gave the management principles, and in this book, I had tried to dovetail those things, those episodes with the current management principles, the vocabulary that the current managers know, so that they should also know that how Ramayana and Mahabharata gave the basics, the fundamentals of management.
True, true. I think even Bhagavad Gita also, we can, we can learn from our ancient times, like from Bhagavad Gita, Ramayana, or whatever the religious books are there. We got the inspiration and what inspired from, can you tell any specific rules of these books so we can get the inspiration and readers also get some insight from the health management or whatever the Ramayana and other side. So can you tell what we can inspire from these four books?
There are n number of things. So within this short duration of interview, it is
You can
impossible
specify,
to
yeah.
impossible to give all those examples. But
True.
actually, this is very good question, because our current leadership, our Prime Minister Narendra Modi, he is also very fond of all these mythology, and he is also quoting a number of things from
Yeah.
these Ramayana and Mahabharata and the other Vedas and the other things, and he is also trying to link up those management principles with these all these ancient mythologies. So what I feel is that the people should know that where are our roots, and from those roots, if you cannot, I mean, you cannot see the roots, but you what you see are the fruits. But the actual
True.
nourishment is coming from the roots. So roots are getting the nourishment to the leaves and the fruits, which the other people can see. So new generation, Generation Z and Generation Alpha should know our roots are in these basic mythology, these basic books in our Ved, in our Puran, and they should learn the management from those basic books. So that is the inspiration that I want to give to our young generation Z and Generation Alpha, and maybe Generation Beta should know.
Yeah. Definitely. And you have, as you said, that you have experience working with the international universities also, university and schools, whatever it is. So, what it has changed your mind from what we can improve in the Indian education and what you have seen in the other countries, like what it shaped your thoughts, like about our culture and their culture in the education system.
See, it is ironical that Indians feel that the North American universities or the European universities are the best,
Yeah.
whereas they are also drawing inspiration from the Asian universities. So
Hmm.
learning is actually mutual. We can learn a number of
True.
things from them, and they are also learning from us. There were a number of things that when we implemented the projects, especially the HIV and AIDS project in healthcare delivery system in India, what they found was interesting was that in India, the people who are working on the ground, how the community engagement is taking place, how community participation is taking place, and how gradually we empower the women so that they can take up all those healthcare actions and do the researches for their own community and come up with the solution. So they were surprised that even with low education, these people are so much educated. So literacy is different than education. So the people may not be literate, but they are educated to the extent that they can plan, they can implement, and they can monitor the health practices in the villages. So this thing the foreign university learned from us, and what we learned from them was that their culture, the way they work, they are ready to work for 24 hours. So in Canada, that the climate is totally different, but in India, in this kind of temperature of 48 degree, 49 degree in Rajasthan, in the area, they used to travel with us and they were very dedicated. So learning was mutual.
Definitely, you have said really correctly because they anyone can learn from anyone. Like we as a child we can learn from our parents, and sometimes our parents can also learn from us because many people have different thoughts and experiences. Definitely. So, what was your experience with SGSH publication? And if you want to give any suggestion or we can improve our services, so you can please tell us.
So as a publisher, you are exceptional. I think every services that you provide is up to the mark, and I think that the basic honesty is there. That is why a new person like me can trust you and go ahead for all the publications one after the other with you. So I think uh, on the part of the layout and the formatting, you are good. On the part of publication, getting the ISBN number and the other things, you are very fast. And you always keep in touch with the author so that the author is not feel lost that where is my publication and when it will be published. So you are always informing the author about what advances are going on. So thank you very much for all that thing.
Thank you, sir. It means a lot, and definitely we are trying. But I think still there is something changes we will do in the future, and it is really inspiring to take the interview of the professor and the principal. It means a lot to me that I am taking your interview, and I want to ask you, like, what was your best memory of your life in your professional career or personal career that you will always remember?
There are n number of memories. The one is with you that the kind of the kind of publications I have done with you. The interaction with the international community is another thing. The
Yeah.
interaction that I do with my students that is also exceptionally good. So I find myself fortunate that God is giving me chance to interact with all good souls who are there on this earth. Thank you very much.
That's great. Okay, sir. And my last question is what is your future plans about the books and your professional?
See, if I get chance, I will like to publish a few more books because the knowledge that I have gathered, I don't want to keep it with myself. I want that whatever
Yeah,
knowledge I have, everybody should know about that. So
true.
my future plan is that I should get some more books published and probably with you.
Thank you. It definitely your choice, and I wish you come and definitely your titles, and I will definitely read all the books. Your titles and the knowledge are there in between. It is really amazing because while editing the book, I have seen some of the chapters which are very inspiring, and we can learn from health management and especially management of Ramayana and this Mahabharata is very useful, I think, and I will read as a as an entrepreneur, you have to read much more. So, what you like to tell about the reading? Like you are still reading the books, and how you tell now a generation reading is important to the others.
Yes, nowadays what is happening that people are shifting from hard copies to soft copy. That is the basic shift
Yes.
from generation X, Y to this generation Z and Alpha. That now they don't prefer the hard books. But if people want to get a fresh knowledge, they have to read the hard copies. So I always emphasize in my classroom that you should read newspaper, you should read new books, you should read journals, and not on your mobile phone, but go to the library,
Mm.
be there and read all those things which are there, because fresh knowledge you will get always in those books and journals and newspapers.
True. Definitely, definitely. I think reading is, reading is not a habit, but it must be a priority for everyone. Okay,
Hmm.
sir. So it was really nice interviewing you, and I have learned so many things from you. Spread goodness. Thank you very much for taking time out for this interview.
Thank you so much, Divya. So nice talking with you. And I hope that in future also we will be in touch for some of the publications.
That
And if you come to Rajasthan, please visit us.
Please, thank you. It means a lot. Definitely, I will come. And if you come to the Mumbai or Mumbai Book Fair, we will put in the store on the Mumbai Book Fair and Delhi Book Fair. If you come there, please meet us.
Okay, okay,
Thank
definitely.
you. Thank you. Spread goodness, spread happiness. Thank you.
Thank you.